Call to order this meeting of the Sacramento First Five Commission for Monday, August 7th, 2017. Madam Clerk, will you please call the roll and establish a quorum?
Dave Gordon.
Here.
Beth Hassett. Terrence Jones.
Here.
Olivia Kasiri. Paul Lake.
Here.
Scott Moe.
Here.
Donna Sneringer. Steve Wirtz.
Here.
Lee Turner Johnson.
Here.
Kathy Kosick.
Here.
Terry Porter.
Here.
Christina Elliott.
Here.
Patrick Kennedy. Phil Cerna.
Here.
We have a quorum.
Thank you.
This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the Local Government Affairs channel on the Comcast, Consolidated Communications, and AT&T UVerse cable systems. This meeting is closed captioned and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, August 9th at 6 p.m. on Channel 14. Members of the audience wishing to address the Commission may sign a request to speak form at the kiosk located in the back of the room. Please include the agenda item number that you wish to address. When done, please bring the completed request form to me. Please speak into the microphone when addressing the Commission and state your name for the record. If you have any electronic devices, please put them on silent or turn them off now. Thank you.
Great, thank you. Commissioner Milk, will you do us the honor of leading us in the pledge?
Yeah. Stand, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Great, thank you, and welcome everyone to this afternoon's First Five hearing. Again, as a friendly reminder, it looks like some people are actually taking advantage of it already. If you wish to address the Commission, you're certainly welcome to do so on any item that's on our agenda, and any item that is not on our agenda, we ask that you keep your comments to 3 minutes so that everyone can have an opportunity to address the Commission if they so choose. So with that, our first item, please.
Okay, and with Commissioner Hassett is out, so Steve Wirtz will be voting in her place, and Olivia Kasiri isn't here, and Kathy Kosick will be voting in her place.
Very good, thank you.
Item number 1, approved June 1st, 2017 draft action summary.
Okay, any commissioner wish to make any changes? If not, I entertain a motion.
So moved.
Moved by Commissioner Moak.
Second.
Seconded by Commissioner Kosick. All in favor? Aye. Opposed, abstained, motion carries. Very good. Thank you. Next item, please.
Item 2, public comments on non-agenda items.
Okay. I'm not in receipt of any speaker slips for a non-agenda item. This is the public's opportunity to address this Commission on anything that's not on the agenda but might be on your mind. I don't see anyone approaching the podium. So we will move on to the next item, please.
Item 3, Executive Director's Report.
Good afternoon, Commissioners. I have a couple of updates for you in my Director's Report. The first was a report out on the state budget, which was pretty decent news for children. It included some key provisions that would bolster our early health and education, including following through on the promise made in the prior budget year for preschool spaces and early learning commitments. So we're really excited about that. As you know, we were at the Capitol and talking to our legislators, and so we're very proud of that accomplishment. Some other updates for the Commission are that we have 3 new staff that are residing with us in the office space. They're from the Dental Transformation Initiative grant. So if you walk the halls, you'll see Deborah Payne is back again, along with Robin Alonji and Catherine Hale Henry. So they're not actually funded by First Five money, but we are closely working with them through all things oral health. Good news for our Help Me Grow collaborative. We have several agencies that have been working with First Five over the last year, a small leadership team, and we've been completing and working on an application to become an affiliate, a state affiliate for Help Me Grow. Help Me Grow is a system for early detection and early intervention of children with special needs. Everything from autism to behavioral, social, emotional issues, attachment disorder, cognitive issues. So we're very excited to join that community. There are 16 counties that are currently Help Me Grow affiliates in the state, and 16 more are in the planning phases. So this basically means that at no cost to us, we get to be part of a broader learning community. And as we move from our currently funded program called Project SOARS into Help Me Grow, it'll be really great to have that affiliate connection and the supports that they can provide to us. A little update on Every Student Succeeds Act, or ESSA, as we call it. We worked with the California Department of Education and SCOE to provide an input session for our early learning providers throughout the county to help inform what that act would look like and provide information from really folks on the ground doing the work of early learning. Commissioner Dave Gordon led discussion, welcomed everyone, was a key player, so thank you, Commissioner Gordon. Also, quick report out that SCOE is hosting their Northern California Early Learning Summit on October 7th. I'm giving you the advance notice because our next meeting isn't until October 2nd, so I wanted to make sure you see in the flyer if you're interested in attending. It is the largest early learning summit put on in Sacramento County, and it's been happening for many years and is a wonderful opportunity. We also have an update. The staff completed our full-day training on trauma-informed approaches, and we are now looking at developing some contract language to help assist our providers also become more trauma-informed, and sort of figuring out what our next steps are in-house. So more to come on that as we figure it out, but our first step was just to kind of get a feel for what we can do, what improvements we can make internally, and then how we might roll out some of that stuff externally to our partners. There's several things around communications and media that are in the report that I won't cover, just to save some time, because we have lots of exciting things on the agenda today. Very exciting meeting. And I just wanted to let you know that, not knowing how long today's meeting would go, there are snacks for you in the back, so please help yourself if you need to get nourished throughout the meeting. And that concludes my report.
Great. Thank you. Any questions for our Executive Director? All right, very good. Thank you. Next item, please.
Item 4, Advisory Committee Update.
You'll note we rearranged the order, did we not?
We did rearrange the order so that commissioners and community could have a chance to speak before they're exhausted at the end of the
What are you going to do with all this new time?
You may not get rid of me, actually. So we'll see about that as it goes. So good afternoon to everyone. It's nice to see you again. Hope your summer has gone well. I'm going to start this off a little different. I'm still going to give the report, but it was a comment by one of our committee members. Walter
Narski.
Something
like that.
Yeah, close. Okay. But he had made a comment. He had watched the discussion about pertaining to fluoridation and being able to fund both. Of course, it was very lively, right? But what he said, and I think you don't hear this enough, he enjoyed watching it because he enjoyed the compassion, the commitment, and the compromise. He could see how passionate you were, all of you, about this, but you were willing to compromise on it for what's best in the community. So he just spoke about that for a few minutes. I thought I should mention that to you, that you never hear that, but we appreciate your work, and we know how hard it is. So thank you. We started off with a mindfulness exercise, which is what to be thankful for Carolyn, that is part of the trauma, and I think she's going to be doing a presentation for us on the Human Services Coordinating Council, so it is starting to spread. We also did an icebreaker, and it was Julie had us doing one about what our childhood nicknames are and why. Sorry, Julie. And Julie's was Cool Jewel. Okay, so hey, I like it. I won't tell them the other one, Julie. But it was a way of us to get to know each other a little more, and why. why was this? And I think we regressed a little bit, and we brought it back. During the executive director's report, we talked about the almost complete strategic plan, and she talked about how the plan will lay a path for allocation of funds to result areas, extensions, available contracts, and competitive bid processes to be implemented. We had some discussion on that and what they saw for that and how it would change. So we'll see as that progresses. We talked about sustainability, and our focus with sustainability is, of course, on policy change, parent-public engagement, and increasing financial resources. So we had a discussion on that, how maybe some collaborations of funds, and a variety of different ways, because we know what's coming up. So we're aware of it as well. We did have an advocacy update. We talked about Children Now and our work with them, and the strategies to support local school districts on inclusion of early learning. We thought that was a great idea. That spurred some conversation as well. And of course, we have TK, Head Start, other services, but we want to see where we fit. We talked about the letter submitted for SB 63, New Parent Leave Act, at 12 weeks, and how they signed a letter of support for SB 379, improved data collection by the kindergarten oral health assessments. We think that is a very, very, very positive thing to hear about this, because we know the effects when a child has a toothache and a child is just not healthy. We did have a presentation, school readiness evaluation. It was the same one here. We found that to be very interesting, and we saw the effectiveness. It's nice to see that once in a while, that we're effective in what we're doing and you're effective in what you're doing. So we were very proud of that. And in fact, Miss Carolyn Curtis suggested having a Twitter party on the topic. And if you're familiar with Twitter, I'm okay with Twitter, but with having a party, having an expert, having people come in and call and getting some awareness. And then we also, our last, had a presentation on First 5 oral health efforts. I think it was an eye-opener to us. I get to see it. I come in here, I see it. Our group a lot of times doesn't realize. So it was a real eye-opener for us, and we saw all the work being put into it, and we had some questions answered. So, is there any questions on that?
Great.
Okay. Thank you very much.
Okay, next.
Item 5, Financial Planning Committee update.
The Financial Planning Committee met last month. The committee discussed the volatility of Prop 10 revenues due to the implementation of Prop 56. Consumer stockpiling resulted in higher revenues in April and decreased revenues in May. Staff is paying close attention to Prop 10 fluctuations to determine if any revisions to projected revenues need to be made. The fiscal year 16-17 single audit is underway. Auditors spent 3 days reviewing documents on site. Another visit is scheduled in August. The auditor has pushed up the schedule this year in an effort to finish the audit in a more timely manner. And the committee reviewed and voted to approve the fiscal year 17-18 final budget and 10-year financial plan. There were no changes or alterations to the allocations for revenue or expenditures, and this item is before the Commission later on in the agenda.
Great, thank you. Any questions? Great, thank you. Next report, please.
Item 6, Sustainability Committee update.
Okay, our fearless leader.
Is your mic on?
Sorry. Our fearless leader, Donna Sneringer, is on vacation, so as vice chair, I will give this update. 2 segments. First, policy and advocacy. The June meeting was held before the passing of the budget, so the committee reviewed the proposal sent by the legislature to the governor's desk. The budget was passed with the necessary child care provisions, and Julie discussed that in her executive director report, and this is a good step for our policymakers acknowledging putting kids first. And for the first time, First 5 was able to have a voice on bills that advanced the First 5 policy platform, First 5 Sacramento, that is. Next segment, System Sustainability Plan, which is the next agenda item as well. We spent the bulk of the meeting reviewing the draft of this plan and then approved it. The next agenda, we will present the plan, its goals, objectives, strategies, next steps, and then the approval of the system sustainability plan demonstrates the forward thinking of the Commission to position First 5 for a future that includes both direct and system change services. That concludes my report.
Great, thank you. Any questions? All right, seeing none. Next item, please.
Item 7, approval of First 5 Systems Sustainability Plan for fiscal year 2017 through 2021.
It's with great joy that we bring you our system sustainability plan today, and even greater joy that I don't have to present it. We have Commissioner Elliott has graciously going to present our, yes, she's offered to present our system sustainability plan that she and the committee worked so hard on.
Hello again. So before I begin, I know that there's a lot of change happening, and I kind of wish my back wasn't to the audience because this is a presentation to our stakeholders as well. The Chinese word for crisis was made famous in a JFK speech many years ago, and he said it contained two symbols, the opportunity and danger. But this was a bit misrepresentative of what that word means when those two symbols are together. It actually, more accurately, means incipient, incipient moment. So a crucial point when something begins or changes. For us, this actually isn't today. This was several years ago. And I joined this commission when my youngest daughter was 2 months old. And the fiscal cliff, our incipient moment, was identified 4 years ago when I joined this commission. And we've had this conversation many, many times, and it's been very difficult. And so today, I think that what we'll discuss here is going to be a representation of the forward-thinking, innovation, and bravery of this commission. So while this is a very difficult time for you all to be commissioners, especially those of you that vote on these type of things, which is not me, I'm an alternate, so that there's a little bit of safety in that for me, and I want to just respectfully acknowledge the work that the voting members of this body have done. So I am the vice chair of the Sustainability Committee, Christina Elliott, for those in the audience that may not know me. I will be introducing this plan to you for your approval. The System Sustainability Plan, in conjunction with the Implementation Plan, each represent 1/2 of the whole plan for carrying out the goals outlined in the 2018 Strategic Plan. So today, I will hopefully provide an overview as to why we need a system sustainability plan now, outline the planning process, how we came to develop the plan, define the goals and objectives. I will review the strategies and discuss next steps for implementation. I will try to answer questions, but if there are questions that maybe are more appropriate for staff, I will certainly look over at Julie. But I will try to answer questions because I've been involved in this process. I feel a bit of ownership over it.
We've lost the mics.
Mic's out. Okay, there, it's back. Okay, so opportunity for new direction, our incipient moment. The Systems Sustainability Plan gives the Commission an opportunity for new direction. We have been well aware of a 20% reduction in funding beginning July 2018, so less than a year from now. And then in 2021, we will face another cut of approximately 30%. Knowing that funding decreases are imminent, 2 years ago specifically, the Commission proactively decided to support policy, advocacy, and sustainability efforts in your work. With staff, a committee, processes, and now a development of an if I may call it an SSP going forward. This is System Sustainability Plan. This demonstrates the forward thinking of the Commission to position us for a future that includes both direct services and systems change services. And before we get further into the plan and the plan process, I think it's important to define what we mean by systems change and sustainability. So if I may read that. Systems change refers to the creation and hardwiring of policies and procedures with the purpose of either reducing direct service costs or scaling out services for more families. And sustainability refers to the process of finding new ways to continue services that have been grant funded in the past. So over the past several months, the Sustainability Committee, with the leadership of Donna and the assistance of staff and our consultants, have began the process of developing this plan that you'll see before you today. And this slide in particular shows the significant milestones that occurred in 2017. The work began, though, in 2016 with the approval of the strategic plan that identified a two-pronged approach to promote the desired results. Serving as a roadmap, the strategic plan guides the development of the implementation plan for direct services and the systems sustainability plan for systems change. Addressing the decrease in funding for direct services, we're seeking to make lasting changes to the way systems serve children and families so that such services are less grant dependent. And I'll note here, for my own personal view, is that it isn't that we have a choice. We do not grow money on trees, and I know that's super cliche to say, but we have to be innovative, we have to be creative, and we have to do this work. As I said at the beginning, this is not easy, and I think that it's really important to continue to note that if we could, we would love to spend billions of dollars on children and families in Sacramento. We just do not have those resources readily available to us. Okay, so this next slide. Early on in the process, the committee defined the goals and the objectives of the SSP. The goal of the plan is to sustain children's health, development, and family empowerment outcomes and the systems that promote them. The three objectives: public awareness and action, policy change, financial resources, and all of these are interdependent, and they need each other to be successful, in our opinion. So public awareness and action. When the public, such as individuals, families, providers, decision makers, people watching now, people behind me in this room, when we all understand an issue and want to see change, we will take action for ourselves and we'll start to demand it from the systems around us. Policy change. While public awareness and action seeks to mobilize the demand for change from the ground up, policy approaches will create change from the top down at two levels: organizational and legislative. And then financial resources. This objective seeks to fill the financial gap that will occur when First Five reduces funding for direct services. Okay, so now that the goals and objectives have been defined for the committee, we were tasked with identifying strategies for accomplishing these objectives. The committee first looked at what we are currently doing and what activities are our top priorities. We literally had giant Post-it notes on a wall. And it was a very heartfelt exercise, and I know that the strategic planning group did similar things as well. All of these are in conjunction with our strategic planning processes. So the strategies were then organized into three areas: existing, prioritized, and other. The strategies in the SSP will occur across a 4-year time frame and takes into account staffing, funding, and resources. Existing strategies like currently funded programs, SAC Healthy Baby, Safe Sleep educational campaigns, some prioritized strategies like support for prior investments, such as decreasing dental disease through educational messaging. Some other potential strategies like current partnerships with Black Child Legacy, DTI, and First Five Association especially, we can influence these outcomes together. So some overarching strategies. All of the strategies outlined in this plan were prioritized by the committee based on where we see the commission being the most effective with the resources that are readily available. The overarching strategies are those strategies that affect all 10 result areas in the strategic plan. These are the top 4 strategies that we plan to implement in this SSP for your approval today. Monitor and advocate for legislation, inventory local funders and our business community. And by that I mean seek out additional resources, start conversations, think innovatively and creatively in how we can partner with them. provide technical assistance, of course, and utilize social media. Some examples for monitoring and advocating. So adopting the policy and advocacy platform and protocol to support legislation is an example of how we do that work. We've done that. This body has moved to support legislation to discuss how things at the state and local level will impact not only this body, but the people that we serve. So in example of inventory, many First Fives across the state are exploring how to generate new partnerships, leverage opportunities with other funders. We don't want to double up on the work, and I think staff have made that statement before. If we can be trim, if we can be lean, we can be effective. And not to hone in on this as a crisis, but I'm sure that this feels like a crisis for our partners that used to receive a certain amount of funding that is going to see these cliffs very shortly. So acknowledging that we are in crisis together, I think, is really important. And we want to make sure that we partner with them in identifying how there may be additional resources, or we might be doubling up on work. How can we be effective in what we have? So an example of providing technical assistance. As our funding decreases, it's important to build capacity of our partners. So not only just figuring out how we can find them more money, to be blunt, that doesn't come from us, but also how can we share technical support to make them effective and make them lean. And this is, I believe, above and beyond, but I think that we all share the same goals, and we all want to help children in Sacramento County and their families. And we can't do that by working in silos. What we know from a technical perspective is certainly beneficial to someone that we partner with. So how can we provide and share an information share, which is good policy and good government practice as well. Not to be on this slide too long, but an example of social marketing. We have a large social media presence, as you all know, and you're all active on there as well. So Facebook, Instagram, Twitter, Pinterest, and YouTube, how can we make that even more effective as we start to be innovative and creative in sustaining these programs? Okay, I'll try to go through this quickly. So result 1, decrease infant death. I will cover 5 result areas from our strategic plan that were identified as systems change specifically. These are the 5 strategies that we will implement over the next 4 years, as I mentioned earlier. And to address specifically on this slide, decreasing infant death. Some will look familiar because they're tied to currently funded programs. And so these will be categorized as existing strategies. And I will note here, I'm clearly not reading directly from these slides, but I wanted to make sure that we highlight certain things as well, and thanks to staff too. So the Commission, along with County and the City of Sacramento, have great investments in decreasing infant deaths and addressing the disparity in African American child deaths. And we want to continue that work. Result area 2, increased breastfeeding. All of you know this is very near and dear to my heart. When I first joined the Commission, as I mentioned, my youngest was a few months old, and I would go pump when these Commission meetings went long. And while that's 2 years ago, it feels like yesterday was the hardest time of my life. So being a working mom, trying to be a good advocate in my community, I'm not alone. Many people behind me share those same struggles of everything that we're going to cover today. So increasing breastfeeding, result area 2, clearly saw, we'll see cuts in the budget item coming up. It's hard for me to talk about because I think that this is a really important public health issue. But the systems change strategies for increasing breastfeeding support efforts ensure that breastfeeding moms receive support and supplies that they need. The ACA currently is potentially an avenue for First Five to work with folks at the ACA to support local efforts. Certainly, we don't know what's going to happen at the federal level, and the Sustainability Committee is keeping a very close eye on that. But we only know the world that we're living in today. We can only move forward based on what the laws are now. So hopefully things can be sustained. Hopefully that there is an opportunity to leverage ACA monies there and to support moms in their breastfeeding journeys. And if not, none of our system's sustainability plan with respect to any of these result areas are written in blood or in stone. What I love about this committee is that this is evident of the ability to be nimble in times of unknown circumstances. So as things change, the Sustainability Committee will continue to try to seek out new, innovative and creative opportunities when things seem like they're crises. Okay, result area 3, decreased dental disease. There's currently a lot of momentum around oral health, which presents opportunities for leveraged funding to offset First Five funding to keep programs whole well into the future. These are our top strategies in working towards efforts to decrease dental disease. This is one of 2 result areas that was identified in the strategic plan as a systems change result. Result 4, increased utilization of medical homes. 99% of children in Sacramento County have medical coverage. 30% of children ages 0 to 5 did not have a well child checkup in the past year. So we've talked about transportation being an issue. We've talked about a lot of the obstacles that families have in they have these resources. How do we get them to actually use them? Our systems change strategy will build public awareness around the issue of utilization. The plan is not to go out and create our own mass media campaign, but instead to work with our partners to distribute materials, make referrals, work with families one-on-one to encourage utilization of their medical home, and instill the importance of taking their children to well child checkups. The goal here is that all agencies serving families are communicating the same message around the importance of utilization. And many of you on this commission hold very influential roles in our community, and I know that you're doing good work around this, so I just encourage us all to continue to communicate this information to your stakeholders that you serve in your capacity outside of these walls. I'm almost done. Result 5, increase accessibility to affordable quality childcare. Another one very near and dear to my heart as a full-time working, outside of the home, working mom. There are not enough childcare spaces in Sacramento County to accommodate every single child who needs care, and the cost of care is increasing. We have the minimum wage increases. There's new laws at the state level that are going to require businesses, which would include preschools, to provide retirement to their employees. And while these are all very good for the people employed, it does burden the business in a way that burden's probably the wrong word, but the money is going to come out from the consumer. So how do we balance these shifting policies at the state level as they impact us all the way down to the local level? First Five alone could never meet these needs. Increased accessibility to affordable, quality childcare was identified solely as a policy result in the previous strategic plan, and it continues to be a systems change result in this strategic plan. Now we're able to put real efforts towards this result, and there's been a lot of strides in the last couple of years. We continue to build relationships with our legislators. We advocate for policy change. As you've all seen, I've brought my daughter Adeline 2 or 3 years in a row to our policy day at the Capitol. She certainly ground crumbs into most legislators' offices. She was eating crackers, but they were very kind. And it goes to show that children And childcare is extremely difficult to come by, and any parent knows that they're not just going to give their children over to anybody. The background checks, all of that doesn't guarantee anything. The hardest thing in any parent's life is handing their precious child over to a stranger. Hopefully over time, that stranger becomes a part of the family. That isn't guaranteed. For someone like me who has resources, I can afford private school for my kids. Even still, there were some issues at the private school, and you really don't know who people are. And childcare is an angst and a fear in this current world, given all that we know that happens to children. And so that's why I feel very strongly about this. No matter what we do, we can't protect our children all the time. So as a policy effort, this is really important, I think. Just recently, First Five supported legislation that was enacted in the state budget, resulting in increased access to affordable childcare. And I am really excited about that. Okay, next steps for implementation. We're investing in systems sustainability work as a commission. We're putting a stake in the ground, if you will. This approach is low cost, obviously. It's feasible in the implementation plan. A total of 1% of our budget for this 2018 strategic plan is dedicated to implementing this plan. $75,000 allocated in this year's budget alone. The committee will be working with staff to develop the operational work plan, which will flesh out the details of the specific activities necessary for carrying out each strategy, identify leads and key players, including commissioners who are valuable resources. We're advocates, and as I mentioned, you're leaders in the community, and a really critical component to the success of this plan. The work plan will also outline financial and staff resources that will be required, evaluation measures, obviously something I care about as well, to be able to determine what success looks like. It's a difficult job to determine what success looks like in something like this, but I think we can. Progress will be reported to the Commission on a regular basis, of course, through our report out, as I did right before this. Julie, the Executive Director's report as well, this will be discussed, or even formally when recommendations call for approval by the Commission. Oops, sorry. So in closing, I would like to thank you for your time. I don't know if a commissioner has ever addressed the Commission, but I do feel very strongly about this, and it is the biggest honor of my life to serve on this commission with all of you. So with that, thank you for your time, and if there are questions, I'm happy to answer them. If I can't, then I will point over there to staff.
All right, thank you, Christina. Very well done, and thanks to the entire committee and staff for putting what is obviously a lot of thought into our biggest challenge in front of us as a commission, not just here, but up and down the state. I think it's thematic with how the calendar year began, which was to be fairly bold in reaching out to our community stakeholders to let it be known that we do have this fiscal challenge in front of us, and we're going to think very deliberately about how best to grapple with it. So this is obviously evident of further thought in that direction. So with that, I think we do have a few questions. Commissioner Hassett?
Thank you. I really appreciate how this fits so nicely with the other work that we've done on the hierarchy and everything, and attempts to fill in some of those gaps. When I hear financial resource strategies, to me it always means fundraising or putting that sort of a program in place, and I'm wondering where we are internally with staffing or with plans for, I mean, a lot of the specific strategies are more around leveraging things that already exist and all that, but I can't help but see fundraising in there between the lines, and I'm wondering what the plan is for that.
Well, I will just say that I'm not familiar with any kind of code that would legally allow us to fundraise, so I can't answer that. I know my board can fundraise, my state board. So, yeah.
We don't have any plans to actually fundraise, to go out and start funding events or anything. Our financial resources is more of looking to others who are already funding in the field of early learning or just early childhood development in general, and to see how we can partner with them on specific strategies that we have outlined here. I like to go back to the Head Start partnership, where we were able to offset, well, we started with 24, and we have 16 more lined up for this coming school year, where we are just slowly offsetting those preschool spaces to Head Start where it makes sense for them to take over. We're also looking at partnerships with other agencies that can't be named quite yet, but I'm really close to being able to say it. So in those ways, and then leveraging dollars where we can from MAW and other places. We hit a little bit of a wall with MAW for being able to draw down additional funds for the current year, but as we do contract negotiations and go into creating contracts for the next strategic plan, we will be looking at specific language and things to reassess whether or not we can actually increase MAW, so leverage new dollars in that way. And then the third kind of way that we're looking at it is, it's bigger than us, but it would be like inviting the Sacramento Community Foundation and others who are funding early child development to say, can we do it more systematically? Is there a way that we don't have to do it in these silos, but if you're funding this and we're funding that, how do we build a system where we all know what we're funding and how we're doing it, and make sure that we're not duplicating and just better use our existing funding that's here already?
Gotcha.
So we do have some ideas on how to do that, and we would really sort of lay those out in the next step, which is sort of that real action plan for each of these strategies that are here before you today.
And I know you have a staff person who was brought on specifically to work on this. Do you feel like we have enough internal resources for this, or?
Well, Latina is a dynamo. So she and Erin are actually both sort of splitting the work on this committee and the work that you'll see in here. So what I like to say is we don't have a lot of funding going toward this, and almost all of it is in staffing. So it's about a 0.6 to a 0.8 FTE. And then a little bit of leftover money to implement some of these, which is about 1% of our new strategic plan. So it's not a lot, but it is, as Christina said, a stake in the ground, and I think it's a good place for us to start. And as things come together, we would probably be coming back to you and letting you know how it's going with and how much of it we're able to accomplish with what we have.
Great, thank you.
Sure.
Commissioner Wirtz.
Thank you. I'm truly impressed with the work of this committee. It's sort of the underlying basis for our hopefulness of the long-term plan for First Five was to institutionalize these services and these plans. So this is really impressive to me. I really want to thank everyone on the committee and staff for all the great work on this. I think it's going to be, as you say, it's a necessary part of what we're doing and essential. The two things I wanted to just sort of highlight, and I think it's overarching that it sounds like it will come out in the work of the committee as they define things, but under the increasing breastfeeding, for example, I don't see anything specifically around the policy and implementation at the hospital and systems level there. I know we fund some of that right now, and it's not that I don't expect it necessarily in this document here, but one of the ways that we partner is really to have institutions institutionalize some of the services that are essential for children and families. So, for example, I know we have hospital-friendly policies in many of our hospitals, but it goes to my second point that I'll make in a second, but even with hospital-friendly policies, there still has to be the hospital commitment, champions, and leadership to ensure that those are being implemented. Around breastfeeding, we know that there are many different views on how that should be done in a hospital, and some of the training necessarily isn't always, and some of the staff aren't necessarily bought into the ways to help women be successful with whatever feeding method they want, including making sure they succeed with breastfeeding. So I look toward that level of partnership, that we get clear commitment, clear champions from our partners like the healthcare systems. And similarly with the medical home piece, obviously the focus has got to be on utilization. And there was a lot of mention about getting messages out to parents and having them, quote, get to service. But I'm a little worried that a little bit of that is blaming the victim kind of approach. I think just as much has to be focused on those, again, the payers and the providers of services, to not just put out messages, you should come to get service, but rather they need to look at their policies and potential barriers that might be slowing down or making it more difficult, and maybe they too need to be more innovative and creative in creating ways in which they reach out to our communities, which struggle with many kinds of constraints that these systems don't have. So again, I think this is going to be a great platform. I think it's going to be nimble, as you say, and we will add to it as we go, and some of it has to be about how we engage our partners in actually doing some of the work that ideally should be in their vision for helping families as well. So.
And if I could take off the presenter hat and put on my commissioner hat, I would say that a lot of the conversations that we've had in the committee have been around these partnerships doing some of that. So for example, there's businesses, right? So one thing that I've been thinking about is utilizing transportation services to get people to their appointments, right? So, well, you have the car seat issue there and the safety issue, because with Uber, you don't really know who's coming, right? So there's a lot of extenuating circumstances, but we're trying to think really innovatively around what these business partnerships look like. And maybe it's just funding for people in their community. Chambers of Commerce are very active in their communities, and they're very concerned with the well-being of the people that work for them, right? So I totally agree. We're trying to think about how we can be idea generators and then bring those ideas to our partners and say, can you do this? Because we can't. And they have resources that we don't, and we have ideas maybe that they hadn't thought about. And so it is really kind of a nimble, innovative, fluid process where if we have an idea, what does it look like? How do we get that, pen to paper? But then, of course, like I said, the safety issues. So there's certainly a lot of things floating out into the air. Terry knows we certainly are trying to be very creative in our partnerships and dealing, having conversations with hospitals and how does that look, the staff time, how do we actually get this done? And so not to put it on us, but I think it kind of does fall on us a little bit. If there's an opportunity, don't be quiet. Make us, comment about maybe how, whatever stakeholder you're meeting with could partner with us. So, and then try to spread the word that way.
All right, great. Thank you. Any further questions or comments on this item? Again, thank you very much for presenting. We do need a motion. I don't have anyone signed up to speak, by the way. Okay, don't see anyone except Aaron.
Historic moment.
Very good. Our historian. Okay, entertain a motion.
I'll move approval.
Okay, it's been moved by Commissioner Gordon. Second by Commissioner Jones. Roll call vote, please.
Dave Gordon.
Aye.
Beth Hassett.
Aye.
Terrence Jones.
Aye.
Olivia Kasiri.
Aye.
Paul Lake.
Aye.
Scott Moe.
Aye.
Phil Cerna.
Aye.
Motion passed.
Very good, thank you.
The next item is on the addendum A1, and it's the retroactive authority for a credit adjustment to the reserve fund in the amount of $276,988.
Good afternoon, ladies and gentlemen of the Commission. My name is Eric Harold, the Chief of Administration for First 5 Sacramento. This agenda item is a standard annual accounting procedure that trues up our year-end accruals with our...
Is your mic on?
Yes, sir.
Okay, maybe you want to lean in a little bit. Thanks.
This agenda item is a standard annual accounting procedure that trues up the final year accruals with the final actual numbers. The adjusting journal entries have already been approved and completed through our internal process, and which includes going through Department of Finance. This year we received new direction from the we must get commission approval to adjust the reserve fund. This hasn't been something we've done in the past. Since the adjusting entries have already been done, we're requesting retroactive authority.
Does that conclude your report?
Yes, it does.
Okay, very good. Any member of the public wish to speak on this item? Don't see anyone. Okay, entertain a motion. Moved by Commissioner Lake, second by Commissioner Jones. Roll call vote, please.
Dave Gordon.
Aye.
Beth Hassett.
Aye.
Terrence Jones.
Aye.
Olivia Kisiri.
Aye.
Paul Lake.
Aye.
Scott Moe.
Aye.
Phil Cerna.
Aye.
Motion passed.
Great, thank you.
Item 8, public hearing, approval of 2017-2018 final budget and 10-year financial plan.
Oh, hello again. All right, just for clarification, I'm presenting the final fiscal year 17-18 final budget. Later on, you'll be discussing the implementation plan, but that's begins in 18-19. So these are two different fiscal years. This final budget came before the commission, or actually the recommended budget came to the commission back in May and was approved. This final budget has the same revenue allocations and expenditure allocations. There are no changes. The only changes that occur are the reserve fund based on our projected revenues and expenditures at the end of the year and where they actually ended up. If you go ahead and take a look at the summary of changes, attachment 1, I've tried to illustrate the effects of our projections and how that affects the reserve fund. The attachment describes what has changed and why in relation to the reserve fund. If you look at the first chart, you can see where we originally projected our savings in the recommended budget. It's in the blue chart. First column, we had projected at that time during the recommended budget that we would have $3.6 million in savings. When our actual figures came back at the end of the year, we now project a $5.1 million savings. There are two primary contributing factors that make up this additional savings, and that is an increased interest rate of around $145,000, and also the capital projects we had budgeted to spend those during this 16-17 fiscal year, but they were not spent, and that comprises $950,000 for the Golden State Water Project and $290,000 for the Galt Pediatric Dental Clinic. So you can see the total in that chart. You can see the total savings of $1.45 million and how it's going to affect the change in the reserve fund for this fiscal year. The change amount saved has a direct impact on the reserve fund. The additional savings will increase the fund balance from $3.6 million to $5.1 million. It will decrease our reserve release from $13 million to $11.5 million. And you can see that in that chart. Now, some of you might be asking, well, is this extra money we could be spending elsewhere? And the answer to that is not really. The commission has already committed these funds to the dental fluoridation projects. However, they are not budgeted in the current fiscal year, the 17-18 year. We do have $2.7 million in fluoridation funding reserved in the budget this year, so we have plenty of money should we decide, should we proceed on the projects. However, I am memorializing the commitment of the balance of the fluoridation projects by adding a line called unbudgeted capital project obligations. And you'll be able to see that on the next form. If you look at attachment 2, the only changes here, this report should be a little familiar to you. The changes here on the call-out box on the reserve fund at the bottom right.
Bless you.
It summarizes the beginning reserve balance with the new figures of $41.8 million. Reflects the new fund balance the new fund balance of $5.1 million, the new reserve release at $11.5 million for total assistance during the fiscal year of $16 million. And there you see the unbudgeted capital obligations to memorialize the commitment that the Commission has already made for the dental fluoridation projects, in addition to what is already budgeted in the budget, the fiscal 17-18 budget. Okay, the next attachment is attachment 3. I typically include this for those of you that like to see the details. So with that, we'll move on to attachment 4, which is the 10-year financial plan. Again, the only real changes are through the reserve fund, and it's reflected at the bottom of this chart. In the bottom box, it's called the reserve fund reconciliation. So you see the beginning balance in the green column for this fiscal year is $41.8 million. We reduce it by the requirements for the fiscal year of $16.6 million, and then I have added the dental obligation of roughly $1.1 million, and gives us a year-end reserve balance of $24.1 million. As you can see in the 2018 strategic plan, which are the next 3 fiscal years, I have withheld or encumbered $20,050,000 per strategic plan year for the next 3 years. And then the 2021 strategic plan has enough encumbrance for $14.25 million per year, which represents around a 29-30% reduction over the previous fiscal implementation plan. And in conclusion, if you look at the 24-25 fiscal year at the very bottom in the yellow box, you will see the remaining balance of the reserve fund at the end of our 10-year plan, which is $3.46 million, which is covers the minimum that we want to keep in there for operating expenses. And that concludes my report.
Okay, very good. Any questions of staff? Commissioner Wirtz.
Thank you. That was very clear. I appreciate that. I have one question on attachment 4 under evaluation. I see there is $103,000 in 18-19, but I do not see anything further on that line. Is that, would you just clarify either it's incorporated in all of them or it's not, or?
It's not incorporated in all of them. We usually keep it there to reserve the funds because the evaluation process for that, the prior year, so it has to be, we have to extend the dollars into the next year so they can evaluate the prior year. And that's why those extra funding dollars are there.
And will those then be available in 1920 and 2021? When, or do we need to explicitly propose those?
It's my opinion that they would remain there perpetually until.
Can I answer that one? So that is money that's in addition to the allocated evaluation funds that you all approved back in June. You had a spending plan that said this is how much is going to program, this is how much is going to evaluation and tour. This is in addition to the allocation for evaluation because we knew that whatever contracts we had in place right now, we would need to have some amount of funding in there so that if they didn't win the RFP if the new evaluation folks or the new contract would be focusing on getting our new providers and getting all the evaluation plans set for the next year. It's not necessarily to evaluate what happened the prior year. So this is actually additional funding.
And it's a
that-
one-time funding?
It's a one-time
That's okay.
additional funding that was put in the budget as part of this current strategic plan several years ago.
Got it.
And we just kept it there to show you that it's there if we need it to round out the current year's evaluation.
Thank you.
Yes.
It just stood out as this,
Yes.
the only number in those boxes there.
Right.
So.
Good question.
Commissioner Moak?
Since you provided the detail, I have a question about the detail, so thank you. Just some clarity. The grayed out section is something I'm sure we're not supposed to look at, but I can see it, so I'm going to ask about it. The leased property use that has $140,000 allocated to it, but in prior years, no actual expenditures?
That represents an account change. It used to be budgeted in a separate account and our different general ledger account. I think you might be able to find it in the prior year expenditures. I'd have to sort through the detail, but it was in a separate account. The expense was there the prior year. It's just like moving it from a lease facility to a lease rental. We have thousands of general ledger accounts, so it's just a matter of where it best belongs, and this was putting it where it should be.
I may have found it. I think it's the second one down under the yellow title. It says rent,
And that one
lease,
is
real
zeroed
property,
out.
and now is zero. So I think it was in there, and now we were asked to move it to lease property use
Got it.
instead.
And then I guess the one down at the bottom, investment services, that typically have gone from a year-end expense in 15-16 at $58,913 and then $88,632 in 16-17, but we're budgeting far more.
That is where we have the backcasting for MA kept. The investment services are, every year we pay 6% to DHHS for processing, being the LGA, which is the local agency for MA, and that carries a fee with it. But we've also put in the backcasting, which I believe was $1.6 million. I'm not seeing investment services. Yeah, it had 1.6 million budgeted before. We spent 88,000 for current year fees, and now we have the 1.68 budgeted as well.
That's just an extraordinarily large.
Yeah, that's the backcasting. We've had it on the books for a while. We're waiting for the state to allow us to pay it back, and once that's paid back, it's all been encumbered. It's, it's not counted as part of the $20,050,000 in the implementation plan.
Okay. Thank you for showing the detail.
Sure.
Okay, any other questions for staff? Okay, I don't have anyone signed up to speak on this item. Entertain a motion. Chair will move. Is there a second? Second by Commissioner Lake. Roll call vote, please.
Dave Gordon.
Aye.
Beth Hassett.
Aye.
Terrence Jones.
Aye.
Olivia Kassiri.
Aye.
Paul Lake.
Aye.
Scott Moak.
Aye.
Phil Cerna.
Aye.
Motion passed.
Very good, thank you.
Item 9, approval of first 5 implementation plan for fiscal year 2018-19 through 2020-21.
Okay, before we hear from staff, go ahead and go to the podium. I believe we have some recusals. Mr. Lake?
Thank you, Mr. Chair. I'm recusing myself from this item because the plan directly names the Department of Health and Human Services, which falls within the county social services agency, which I administer. Thank you.
Okay, and who's playing the part of Donna today?
Mr. Chair, I will recuse myself as the plan includes programs within my agency.
Very good. Dr. Kassiri?
And Mr. Chair, I'm recusing myself as an employee of Department of Health and Human Services.
Very good. Go enjoy some snacks back there. Okay.
Good afternoon again. Very excited to be before you today to share our...
Commissioner Hassett?
If I'm a subcontractor, do I need to recuse myself?
To which agency?
Most of the family resource centers.
In an abundance of caution, I would say yes.
Okay. Weave is a subcontractor at most of the family resource centers, so I will recuse myself.
Okay.
Snacks.
Do we have we maintain a quorum with voting members, correct?
Mm-hmm.
Okay.
Great.
Now you can start.
Yes, good afternoon again. So the implementation plan before you today expands on our strategic plan, which you approved in June, and it provides the detail for each of the strategies in each of the result areas. It's staff's recommendation for how to invest more than $60 million over the next 3 years. And that's $60 million. This is a huge amount of money. I'd like to thank the staff who really created this plan, or the document. That's Carmen Garcia Gomez and Linda Fong Samara. I'm sure that they go to sleep at night. It's like burned into their heads. They have visions of the implementation plan. And all of the staff who worked on it, thank you very much. I'd also like to thank our providers out here. Their input during our strategic planning process was just so helpful, very critical. They have a deep understanding of the needs in Sacramento County, and their input really helped also inform this plan before you today. So this should look familiar to you all. This is our hierarchy, which provides the framework for our investments over the next 3 years. As you can see, we have 3 priority areas, 5 goals, and now down to 10 results.
That's amazing.
And the implementation plan before you today, it will detail both the direct services side, so everything it provides detail for all of the yellow and yellow-green items, and it provides funding allocations for all 10 of these items of result areas. The implementation plan includes a general overview of the strategic plan with the planned expenditures. Each result area. There we go, we're back. And each result area that you'll see also has a summary chart at the bottom at the back of the document. And the summary chart, sort of that's where all the details are in. It includes the implementation strategies, the target populations that we're going to serve in those result areas, the funding mechanism, so whether it's going to be a competitive process or a non-competitive process, and what the total 3-year allocation is for each result area. It also, at the beginning, includes indicators, so what we're going to track. These are what we know today, but those indicators may grow, as well as a detailed evaluation plan is created after we've approved. And each chart ends with a summary of the planned expenditures, and those expenditures include the contracts that would go out to community, as well as staffing costs on First 5 Commission part, our media, program support, policy advocacy, sustainability, and all the sort of blacked out areas on that budget detail, which were allocated costs. This slide provides a quick look at the planned program expenditures for each result area, and it also reveals how much of the total program budget is being allocated for each result area. So for example, if you look at decreased infant death, it has an allocation of nearly $3.8 million over the 3-year plan, and that represents 7% of the funds available for direct services. And as you can see, our largest investment is effective parenting at $25 million over 3 years, which represents 46% of our available funding. In addition to the funds allocated to the partners, there's also other costs associated with operating programs. Those are things like program management, program support, media, allocated costs. All combined, these program expenditures will total $54.5 million of our $60.1 million allocation, or about 90% of expenditures. We will invest 3% in evaluation, which is about $1.7 million over 3 years, and about 7% in administration, $3.9 million. The next 2 slides will provide an overview of the strategic plan result areas and the strategies to be implemented. You can see the percent reduction based on the 2015 strategic plan for each result, as well as the total allocation available for funding over the 3 years. Reductions to the result areas were based on prioritizations made by the strategic plan work group, who closely followed the Commission's own funding principles, which were to go narrower and deeper, and to address disparities. These were tough decisions to make, but we did have a process in place, and we've basically followed it from beginning to finish. All the decisions were made very transparently, and I think with great integrity on behalf of the work group, commissioners and staff involved. The decision-making process for the allocations were carefully vetted through that work group. Providers had opportunity for input during that process, and like I said, we really appreciate their contributions toward the final product. A draft of this document was shared back in December of 2016 with the commissioners, and it was modified after we identified some additional internal savings. So the picture of the implementation plan is actually a little rosier for the amount of money we can put into contracts than it was back in December. So there's more funding for direct services because we were able to find some additional cost savings in operations. This is the second slide, which will take you through result areas 7 through 10. You'll note that we've combined result areas 9 and 10. Those really speak to birth and beyond, and so we just kind of lumped them together. But you can see the recommended reductions and the amount remaining for contracts. I did want to talk briefly about what the major differences are between this plan and the current plan that we're operating under. With our decreased budget, we have continued to go narrower and deeper with our investments. We reduced the number of result areas from 15 down to 10. We changed several of them from what used to be a direct service, a contracted direct service, into a systems change result area or strategy. The strategic plan work group prioritized 2 major areas, which was core school readiness services and core family resource center services. Those are sort of the legacy programs, and as you saw, did have the majority of funding in them. We reduced internal operations by 22%, as I said, putting more than we had originally thought into contracting for direct services. And as you can see from both of the presentations today, there's a real symbiotic relationship between the implementation plan and the system sustainability plan. We're intricately involved in both sides of that, and we really do need to work together. They are put together. They are how we're going to implement the strategic plan for next year. Oops. Our next steps are detailed on this slide, and it includes a release of both competitive and non-competitive processes to ensure no disruption of services when we get to July 1st of 2018. And in addition to these steps, staff will add new requirements for our contractors. This is primarily came out of our system sustainability plan because we recognize the effects, the profound effects of adverse childhood experiences. All of our contracts will include requirements for trauma-informed training and delivery, service delivery. And our service providers will be required to provide even more resource and referral around several of our results that we were identifying in the SSP, and those are specifically around child care, dental care, and well child visits. And then service providers will be required to leverage at least 10% in other funding each year as they build their own system sustainability plans. As the Commission faces our declining ability to invest, efforts will continue to become narrower and deeper. We know this. We just saw Eric present 20% reductions this coming up cycle, up to 30% for the following. Creating the strategic partnerships that will leverage and grow funding for young kids is vital. And the direct services and systems change strategies within this implementation plan and the sustainability plan will help the Commission focus its investments to be lasting, even while we're directly serving kids now today. And as I said, the two documents really come together to be the roadmap for our strategic plan. And that concludes my presentation, but I'm happy to answer questions.
Great, thank you, Julie. Any questions for Julie? Commissioner Wirtz?
Thank you. I will just acknowledge the hard work that's involved in this and difficult decisions that need to be made in this. And I think you've done a great job of getting input and balancing things and following through with the strategic plan vision, I think, and we're stuck with having these cutbacks, so I appreciate that and the difficulty of it. I actually have a fairly simple question about, you had mentioned that there were indicators, initial indicators or something, and oh, now I see them. Okay, they're above. They're not in the charts themselves.
Correct. It starts with those indicators, many of which are things that we are currently tracking and or came from our, as we developed our results-based accountability, our RBA, for each of the result areas. We popped some of those in there too.
Thank you.
Sure.
The other question was just more in the actual, I take it this is the one version is the actual report itself, and then there's the slides. The actual report doesn't have this % reductions, and I'm wondering if this is the final report. That's fine, they go together, but otherwise it would be good to have those % into whatever is considered the final report, I think. But
so in the body of the actual implementation plan, maybe a little parens next to the dollar amount that's being allocated, like what kind of a cut that is?
That would be, yes, that's the kind of thing I'm suggesting. A minor point because it's in the slides, but
sure.
Thank you.
Commissioner Elliott.
So I'm in no place to give direction on any of this. So if the Commission would be comfortable, some things I've been thinking about with respect to the contracts that we enter into, encouraging our partners to be breastfeeding friendly to their employees, I think would be awesome. And then, of course, family friendly workplace type policies. We want to partner. I would like if this Commission partnered and contracted with firms that had family-friendly policies that encouraged and provided safe space for their employees to breastfeed those that need it. So those types of things. Part of sustainability, I think, too, is partnering with and encouraging our partners to have the same values that we have.
Good. We can do a little addition to that, too.
Thank you.
Okay. Commissioner Wirtz again.
I apologize, but I want to acknowledge something here that I'm not sure is not a first here for California or elsewhere, and that is that you're building into the contracts a request for all our providers to become knowledgeable about the science of adverse childhood experiences and the trauma-informed growing literature on how practices can be improved. I'm not sure that I've heard any other first five in the state or any other public agencies necessarily taking this kind of a stand. So one, I'm thinking even for Aaron that this could be it is a noteworthy, excuse me, but it could be newsworthy. Let's put it that. Those aren't, and I'll just say that as part of the California Department of Public Health, our Small Essentials for Childhood initiative is trying to document how well we're moving toward making California a trauma-informed state. And I would argue that this is a powerful leadership position that the Commission is taking with regard to this, and I certainly applaud this, and I look forward to seeing how both the state can potentially help Sacramento County in this direction, as well as watching how you could help the rest of the state and nation move in this way. And I'll just mention two things that just tie directly. Our funder is the Centers for Disease Control and Prevention, and their science officer has been doing a great job of trying to publish in the peer-reviewed literature about how trauma-informed practices, about how family-friendly business practices actually translate down to how families struggle with raising their children in a safe manner. One of the articles has to do with demonstrating that paid family leave in California that's been in place for a good while was correlated with a reduction in abusive head trauma cases across California compared to 13 other comparison states. So I just want to make the connection that it's not, when we talk about policy and systems change, we're not just talking about that as, you know, a good thing and good policy. It actually does translate to how families are able to struggle with the stresses and challenges they have. And there is a growing body of literature to make that connection. So again, just kudos to the forward-thinking approach here and to getting your staff trained and now opening that opportunity to others. It's just a model for the rest of the state.
Thank you. I appreciate that. And it's not only what we believe in as staff, but our advisory committee, this is one role that they've really played, which is really sort of pushing us along on this and saying, as an advisory group, we think the Commission should be going in this direction. So it's a perfect model of how we use that group and how they have an impact in the way we do business at the Commission. So it's kudos to, if he's still here, I don't know.
Commissioner Costa.
Robert.
I wanted to thank Julie for her leadership in both of these large items today. I know it's been difficult to get everyone involved, but getting the whole community to give input and the commissioners and the public who have participated has been well received, and I want to thank Julie for her leadership in this area. I did have one question on the contracting requirements on the 10% leverage. Is that going to be required to be documented on an annual basis? And if a provider does not meet that, are there sanctions for the next year?
I don't know that we have thought about it at that level yet. That's probably something that would come through the Financial Planning Committee to talk about a policy around that. It's just something that, well, it's something that I used to do in YOLO, and it provides some skin in the game, and it really gets folks thinking about what they can do to go out of their way to bring in something additional, and I would like to implement it here, and so I put it in, but I don't have the details on it yet, but probably through your committee.
Okay, thank you.
Yep.
Commissioner Moak.
And I'd like to also piggyback on Kathy's comment about sharing some kudos for staff. I know that this is, this isn't the most awesome of circumstances to have to bring a bunch of people together when you're talking about less and less and less. And, and yes, we have, to Commissioner Elliott's point during her presentation, we have certainly been talking about this for 4 or 40 years or something like that. And so this, if anyone is surprised by where we are today, then you've been sleeping a good slumber for the last 4 years. But it doesn't make it any easier when we are now truly facing it. And I think that, so kudos to you for steering the ship in the way that it has to be steered during these difficult times. And I think additional kudos to many of the people that are sitting behind you and who have been through this for so many years and weathered various storms along the way. I mean, I can remember one strategic planning session we had probably back in 2008 or so, where the facilitator was talking about, the art of strategic planning is choosing what not to do. And I feel we're faced with that right now, and some of these cuts or reductions are certainly examples of that. But what I, as a avid food show watcher, because I'm a fan of the food, let's be real. I also, if you've watched these shows, they get down to these 3 incredible chefs, and they're making these ridiculously delicious dishes, and all 3 of them are delicious. Like beyond, like the best things you've ever eaten in your life. But 2 of them are going home. Right. So I feel like in the weirdest of ways we are dealing with that. Like there are some people in this audience, there are people not in this audience today who have been serving delicious dishes for a long time. And they get to go and continue to cook, but maybe in a different kitchen for a little while, or figuring out how they get to partner up with the people who are still going to continue. So I do want to give tons of credit to those who have been with us for this long ride, and credit to those who are going to stick on despite with less to do it with. And it'll be interesting for sure, but I think it's only going to bring us, I hope it brings everybody closer together to work harder, more collaboratively, and looking for creative ways to continue forward.
Thanks. Thank you. Commissioner Turner-Johnson.
2 things, and the first one is just to add my kudos to the work that it has taken to come to this financial implementation plan. I think for 4 years before I came on the commission, I served on the advisory, and I was part of the evaluation committee too that actually helped to determine funding for any number of these folks that we're looking at. And I know the whole community has been waiting with bated breath to see how all of this discussion that we've been having is going to settle. It's never a good time when you're looking at either elimination or reduction of funding. Everyone writes sustainability plans when they write grants, but always with faith and hope that, we'll carry on. What I do want to say is that your leadership and all of the people that have worked so hard on it deserve incredible kudos today, because my opinion is that the work you've done to bring it to the place you have with the choices you've had to make is really remarkable. So I just want to say that. It's not easy, but I know from what has been said with Christina earlier that the technical assistance in the way that we'll support to try to help, at least with information that will help them, is going to be important, because it may reduce some other expenditure of theirs and help them. The second thing I want to say has to do with trauma. I didn't think I had anything to say about that, but listening to Commissioner Wirtz, I realized I have one thing to offer, and that is that in my work teaching as senior faculty adjunct for Pacific Oaks, the last few semesters, we have an accredited site at Roseville, and the last few semesters, my graduate students in particular, and actually the undergrads, have gotten so deeply into issues of wanting to work on trauma in their classes, and I always try to flex the agenda around what's going on. What I'm seeing is that it is coming up in every single professional's life that's out there with children and families. families. So the one thing I want to offer, because I started digging down and finding some more interesting things to bring to them, and I have been finding some amazing research, one of which I should share with you. This particular one, I won't quote or cite it or anything today, but really what it talks about is that there are some critical milestone times in children's lives, 3 to 5, I think it's about 7 to 9, and then around 11 to 13, latency and puberty, where children that experience trauma in those particular times have a stronger possibility of having lifelong, experiences from this. And I just want to add one last thing. The thing, not that this is anything shocking or rocket science, but the one thing that mitigates, because you can't cure trauma, but the mitigation that works the best is that they have one person minimum that they have an incredible attachment to from that point on, if they haven't already had it. And I'm talking about really severe trauma. I'm not talking about because we have paid parent leave. I'm talking about much more multiply and severely involved trauma. But I just think it's remarkable when it's this infiltrated into our everyday lives and every class that I teach. I know that we're on a pulse that we should be so proud of being part of. Thank you.
Commissioner Wirtz.
Thank you. This, as you can tell, both is a critical issue for a lot of us. And one, it's very hard to follow Scott with his metaphors, and but he's got other professions that help him do that. So I kudos to that.
Chefs and ships. Yeah.
Two things I want to say is that I really appreciate the work again, because being on the strategic planning group, we were able to not have to make those hard decisions at the time. So I want to acknowledge that and say that we were pleased that there was a further mechanism that would work on that. Then I'd just say about trauma, we try to, yes, you can mitigate it and so on, and we focus a lot on resilience, but as a public health perspective, we also prevent it. And our programs here in First Five are one of the major tools for preventing trauma from occurring in the first place, which is by far the best approach for our families and children. The question I had around the leveraging, and I'm not proposing this, I'm just asking whether there was a thought that this each year it was going to be 10% matching leveraging, or is there going to be an increasing number as it goes forward?
We had only come up with this 10% of overall, not per year increasing, but it is something that we can take to Financial Planning Committee and come back with a fuller description of how that will shake down.
Okay, thank you.
Okay. Thank you, Julie. I appreciate what you mentioned early in your presentation about transparency and taking the time to meet with commissioners individually. You and I shared a number of conversations about certain aspects of the plan and reduction areas, and do appreciate that, as difficult as it was to really discuss and contemplate. We went into this with eyes wide open thanks to your diligence, so thank you.
You're welcome.
Okay, I need a motion. Been moved by Commissioner Wirtz. Is there a second?
Excuse me, Mr. Chair, does that include the addition by Mr. Wirtz of the percentages?
Yeah, and it wasn't just Commissioner Wirtz that made recommended slight change, right?
Yeah, I have the other change in here too. Well, the other change was just that we'll come back with greater detail later around the leveraging.
That's fine.
Percent, yeah. But adding the percent cut specific to each result area into the body of the implementation plan. I have that.
Okay, so let the record show that that's part of the motion. Okay.
Sorry, can I mention something? Also, I'd like to acknowledge Commissioner Elliott's desire to include some policies around family friendly.
Oh, yeah, that was the other one.
Okay. I'm sorry, did we have a second? Chair will second. All right. Roll call vote, please.
Terrence Jones.
Aye.
Scott Moe.
Aye.
Steve Wirtz.
Aye.
Kathy Kossick.
Aye.
Terry Porter.
Aye.
Phil Cerna.
Aye.
Motion passed.
Great. Thank you. Okay, last item on our agenda today is commissioner comments. course, Mr. Wirtz.
I'm so sorry, but I had arranged for...
We're going to have a discussion one of these days about consolidating.
I just wanted to note that the evaluation committee item was not on the agenda, and I think I talked to Julie about having it be a standing thing on the agenda, even if...
Or other time to come back.
Because it's the last voting item, they left.
Oh, thank you.
Just, sorry. So one, I think it makes sense that the evaluation committee be sort of a standing item on the agenda, and then I could say no report. And in that regard, I'll just mention that we did not have our July meeting because we were working on resolutions and clarifications around the evaluation of the Birth and Beyond programming, and had some very productive meetings with staff and providers around that. So we intend to have our meeting August 21st. So I mainly just wanted to put that on the record.
Okay, great, thank you. Any other commissioner comments? I will just make mention of the fact that we had another extraordinary national night out. This isn't necessarily just reserved for First Five. I'm sure it intersects with a lot of things that our commission does and our commissioners do, but we had a third annual National Night Out at Jack Davis Park, and Mr. Moak was good enough to be there, and we had a First Five presence. Aaron Murray was there as well. We made sure that age-appropriate youngsters, 5 or younger that were there, were given a backpack, and had a chance to discuss with some of the parents of those toddlers the import of First Five, and in fact just explaining what First Five is to many people. So again, I think it's important to reflect on these types of community events that prove to be very effective in broadcasting what we do, how we do it, and the fact that they should take advantage of what we have to offer. All right, if there's no further business before this commission, we are adjourned.